Now that fall is in full swing, that means fall allergies and cold and flu season too. So how do you know if you're suffering from cold symptoms or the flu? Ed Neuzil, registered nurse practitioner at the Allergy, Sinus, and Asthma Family Health Center, talks about the differences and the importance of immunization.
Well, understanding cold and flu, are two different animals, okay? Cold and flu are both viruses, but the symptoms are dramatically different. So when we're looking at the colds generally are more of an upper viral infection. They can affect the nose, the throat. Very commonly I have patients come in and they say, well, my throat was scratchy the other day and it was a little bit hard to swallow. It's getting better, but now my head's all stuffy and my nose is plugged up and it's running, but everything is clear. Okay, so that's generally more of cold-like symptoms. Flu, you're generally looking at something a little bit different. You can actually have the nausea with or without vomiting. You can have gastric cramping. You can have diarrhea. These are more of your flu-like symptoms. So there's a big difference between the cold and flu. Now, what happens with the virus, they can actually predispose you to develop bacterial type infections because of the inflammation, because of the mucus and the fact that it may not drain appropriately. Now the normal bacteria that we have in our bodies can actually what they call colonize. And so now, even though you started out with a virus, you can now develop that bacterial infection. And that's why I tell everybody that the use of the flu vaccine is almost a must. The person that says I never get sick has been very, very lucky. They may have an excellent immune system and that may hold true the rest of their life. However, for those people that have had the flu, can tell them you don't want to get it. You don't want this to be the year that you can't say that anymore. And so my suggestion to everybody is whether you're susceptible to getting the flu or not, if it's something that is not contraindicated, it's advisable to get.
The Centers for Disease Control and Prevention recommends that everyone over 6 months of age get a flu shot. It takes about 2 weeks after vaccination for your body to develop an immune response. Get vaccinated now so that you will be protected when the flu season begins. In the United States, influenza season usually begins in October and can last until May. You can map the location for the Allergy, Sinus, and Asthma Family Health Center when you check out the exclusive Hometown Health Specialist Directory. We've also included web extras with more information about influenza myths and facts. Just click the Cold and Flu Season story link on our homepage, yourhometownhealth.com.